Omaha's news leader, chronicling the stories and people making a difference in our community. This is KETV News Watch 7's Chronicle.
Well, another school year is already here for thousands of Metro students. More are returning to class this week and later this month. Good morning. Thanks for joining us. I'm Rob McCartney. This morning, we're focusing on the health and safety of your students as they begin a new semester. A doctor from Children's Hospital joins us to talk about vaccinations, getting back into sleep patterns, and other health habits to begin the new school year off right. Plus, the head of activities and athletics at Millard Public Schools is here to walk us through safe practices for athletes. Also going to talk about the importance of student and healthy parent involvement. We begin with Metro districts preparing for the new year. That means thinking about the chance for more COVID infections. It's the third year of pandemic protocols being on back-to-school lists. And KETV News Watch 7's Joey Safchik spoke with doctors who say it's something everyone should be thinking about.
We know that kids being in school is a good thing.
Lessons learned from years of pandemic teaching.
We built this plane as we were flying it.
Jenny Benson, president of Nebraska's Education Association, suggests schools around the state embrace CDC guidelines this year.
We're very confident using the CDC guidelines.
Even so, everyone's on the same page about one thing. Each district, school, and even classroom will have different needs.
Given that vaccination rates vary widely in different parts of the country, it's really tough to have one guideline that would fit everywhere.
OPS and Millard already announced they're adhering to Douglas County Health and CDC guidelines, so parents should be prepared to keep their kids home for 5 days if they test positive. CHI Dr. David Quimby recommends getting kids vaccinated.
It might not be the best at preventing all illness, but it does tend to make illness less severe.
Benson says higher vaccination rates can help solve a crucial problem: low numbers of substitute teachers, with retired educators more willing to step in.
We're hoping that we can get them more into the classrooms this year.
In fact, Benson reports there's already a backlog of subs ready to return, as the textbook for pandemic teaching is cracked open again.
We really want to make sure that we're focusing on what is the common ground we can find, not what divides us, but what brings us together.
As Joey Safchik reporting, you heard Millard and Omaha's COVID policies. Here's a look at what some of the other schools are doing for the upcoming school year. Ralston says its plan is based on guidance from federal, state, and local health officials. It's keeping masks optional, but asks that students or staff not come to school if they have COVID symptoms. The district says it'll monitor the health of the community and work with Douglas County Health to make changes as needed. Bellevue Public Schools has a similar plan, masks optional. Students and staff should screen themselves for symptoms before coming to school. The district says it'll work with the Sarpy-Cass Health Department when positive cases and outbreaks come up to determine isolation and other mitigation strategies. In Elkhorn, that district's policy states any student and staff with a positive COVID test will need to quarantine at home for 5 days. They can return if symptoms improve and there's no fever without the use of medication. Gretna Public Schools also shares that policy. Westside says it is consistently connected with Douglas County Health and neighboring districts to determine best practices. They will no longer do contact tracing or reporting positive cases. Instead, Westside asked parents, students, and staff to treat COVID as they would any other infectious disease and stay home if they're sick. But if they test positive, they should contact the school for a date on when to come back. Papillion-La Vista Schools is still working on its plan for this school year. District says it will post that on its website when it is finished. So, another year of special considerations. And here now to talk about your child's health is Dr. Shannon Godsell. She's a pediatrician at Children's Physicians Val Verde. Thanks very much for being here, doctor.
Yeah, of course.
So, from a medical professional standpoint, how critical is COVID testing?
So I'll tell you that it is critical in the sense that if you're kind of questioning what kind of symptoms your child has, how severe is this when we're talking about going back to school? What is your family situation like? If there's lots of people in your family who are potentially immunocompromised, whether you've got a grandparent that might be elderly or a child that's under the age of 2, you really should be thinking about testing because COVID tends to affect those who are immunocompromised very differently. But I have encouraged encourage parents that if they're questioning it, it is best to get tested to just know.
And just about the protocols in general then, staying home and all that, should they still follow that?
Yeah, I think it is important to, again, to know your school's policy. But if you're questioning anything, you really should talk with your pediatrician, because I think that there's lots of differences and there's lots of information out there, but talking with your pediatrician is going to be best.
And some people may say, I'm only going to test if I have symptoms. Should they do that?
To be honest, that's what's hard about COVID, right? I mean, we're almost 3 years in the game now, and we're still really struggling with what it can look like depending on the person. And so I think that if there's any question at all, it is best that you test. And again, reaching out to a healthcare provider is going to be the best in order to just talk this out and get some good plans. Yeah.
This is the old better safe than sorry.
Absolutely. Absolutely. Yeah.
Beyond COVID, let's talk about what students should be doing to give them the best chance to learn. Is there any one most important thing they should be looking at as they go back?
You know, as a pediatrician, the thing that I love the most is vaccines.
Sure.
Outside of my kids themselves, I really do want kids to get vaccinated. And so we are encouraging everyone to get vaccinated before they're going back to school. So not just COVID vaccines, we think that's incredibly important, but to make sure that they're up to date on everything else that's recommended by the CDC and the American Academy of Pediatrics.
It's a pretty long list though, isn't it?
It can be, depending on the age of your child, but there's a lot of importance to it. And so, you know, we've found, unfortunately, that in the last few years with COVID, that a lot of people are not getting vaccinated like they used to, or they have lots more questions about vaccine schedules. And so again, as your pediatrician, we really encourage that you're reaching out and making sure that they're all up to date so that they're best protected when we're back into the group setting at school.
Are there particular viruses or bacteria that are common in schools based on age? For example, things in elementary school, are there more viruses there than there are, or different viruses than there are in high school?
Yeah, so I'll tell you that in the last few years, we actually saw pertussis outbreaks or whooping cough outbreaks, and we tended to see that in the older high school setting. So that's why it is really important that your child is getting vaccinated against that, and typically they get that around 7th grade. So it is really important that they're vaccinated against pertussis. There's other viruses and bacteria that can be seen more commonly like in daycare settings or younger kids, but to be honest, it can go across the board. And unfortunately, even kids that are healthy can be affected by certain viruses differently. So we used to think that there were certain times of year that you would see a virus, and now it's any time of year. So we are encouraging parents to reach out if they're questioning what their child might have.
So is it a little cold and flu season that we always hear about? Is that a little different?
It is different. So, you know, when I first started practice 5 years ago, I was starting to see kind of winter type viruses in October at the earliest. Now I'm seeing them in the spring and summer. And one of those is, you know, RSV, or respiratory syncytial virus. And so I don't think there's a time frame anymore.
You know, one of the big things is kids, and I was guilty when I was raising my kids, they get out of their normal sleep patterns. You know, we'll just stay up and watch a movie or something a little bit later on.
Sure.
How do you get them back in?
So I've been telling my kiddos, because, you know, now that school is starting up here in the next week or two, I've been saying we got to get back onto a schedule. It's really important a few days before, even a week ideally, before we start school, to get those good sleep routines back in place. So for our elementary schools, ideally, I want them to be getting 10 to 12 hours of sleep. For our teenagers, 8 to 10. So it sounds like a lot, especially when you're talking about what they've been doing in the summer, right. But it is important that we start doing it now.
What if they don't? I mean, what's the downside? I mean, you have sleep drowsy kids at school? What?
I mean, not only are you worried that they're going to be sleepy during school, but that, you know, they're not going to be retaining a lot of the information. If they are involved in activities, they're going to be exhausted by the end of the day. And then when you're talking about homework at the end of the day, how are we going to be able to do all of this on such little sleep?
Schools do a great job feeding kids. I mean, the meals, you know, kids always complain about the quality of the meals, but the meal, I mean, they're nutritionally, they're good. But when you get home, some families have trouble, you know, maintaining that nutritional level. Any advice for them?
So another thing similar to sleep is planning ahead of time. So I feel like it's a lot easier to grab something potentially unhealthy when you're doing it last minute and you're just kind of grabbing something on the go. But it is really important if you take the time to set menus for the week and set up your lunch for the following day. Then you can ensure that you're getting a full balanced, meal, even though it might seem like, you don't have a lot of options. When you can think about it, you can consider a lot more healthy things.
And you can also get the kids involved in that too. I mean, that would be critical, I would think.
Absolutely. Then it doesn't seem nearly as stressful, right? Because instead of trying to jam pack a lunch pack in the morning, you are able to talk about it the night before, and then there's not typically, hopefully not an argument, at that time, and you have just more time to talk about it and make it more fun.
And you can have the parents can say, hey, you chose this. I didn't choose. You got deniability, right?
This is what you get, yeah.
Right. Hey, medical opinion. Just curious, can there be such a thing as too much time spent on homework? It used to be that you'd spend a lot of hours.
Sure.
Theoretically, you were supposed to spend a lot of hours on homework, and now there's a move to cut that back a little.
True. And I'm lucky enough to know a lot of teachers who are absolutely wonderful and really are working on this and trying to pull that back. I think what we're learning now from a pediatrician standpoint and from a healthcare standpoint is that most of homework is on the screen now, right? And so we're really trying to balance that out because it really is important that we're spending time outside, with activities, being active. But when you have to get homework done, that's more time on a screen. So I do think it's important that parents have conversations with their teachers about what the expectations are when it comes to homework, and knowing that it is really important to have a balance for your child to get outside, get active, and get away from a screen.
Yeah, so it's great advice, and actually we're going to talk about that coming up. Doctor, appreciate you coming in today. Great information as always.
You got it.
Well, so another year of special considerations we talked about. We're also going to talk about that activity. Means start of school sports and clubs. So coming up, head of Millard Public Schools and Athletics and Activities is here to outline what's in place to keep your child safe. And we're going to talk about the benefits of getting involved. That's up next.